Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe. This is a concise, well-crafted summary and it highlights only the important keywords. Neuromyelitis, optica, and the osmotic demyelination syndrome. So first of all, in case of the neuromyelitis optica, here there is more than 3 vertebral levels are involved. So more than 3 vertebral levels are involved. That is, it is a long segment involvement. Next is there is presence of the aquaporin. So aquaporin 4 antibody we see. This is present in case of the NMO. Then moving on to the osmotic demyelination syndrome. So here there is history of the alcoholic patients. This is with rapid correction. So there is a rapid correction of hyponatremia. It is previously known as a central pontine myelinosis. So in case of osmotic demyelination syndrome, the history of alcoholic patients with rapid correction of hyponatremia, it's previously known as the central pontine myelinosis, as well as there is presence of the Trident sign. There is something known as a Trident sign. So Trident sign or the piglet sign. So Trident sign, the piglet sign, as well as the piglet sign of the pons. To learn and grow daily like this, please do subscribe.